Today's session, are you all ready? Good morning, all dear doctors. Dr. Arya,
Morning, ma'am.
Soumya, Kailvedi, Sai Narendra, Sufaira, Shaini, Shubhangi, Nuha, Anusha, Archana. Good morning, all. So today, I think we will start with one doubt clearance. Without clearing the doubt, we cannot go into the class. So in the group, I don't know which doctor this is. Is this Sai Narendra?
Yes, ma'am. Yes, ma'am.
Okay. So it is regarding the thyroid, hormonal reports, state of mind or pathophysiology of mind from hormonal reports. Yeah, of course, as you know, hormones, there are different kinds of hormones, but coming to the thyroid hormone, actually it is a metabolic hormone. Either you will go in obesity, you will gain weight, or you will lose weight. Hyperthyroidism means the metabolism will be more, and hypo means the metabolism will be lesser. So here, it is all about the speed. If it is hypothyroidism, it is less of speed, and it is hyper means it is more of speed. What does this mean? This means performance in life. Where are you not able to perform up to the demands of life? Sometimes life will be very much demanding, very much snatching from you the energy that you will not be able to give the result. You will, however you perform, however, whatever energy you collect from your body and you want to perform, but then no result is achieved. In that case, you may go into hyperthyroidism. You are performing, you are running fast, you are sleepless, you are working hard, just like the key, like we will say Budam, we will say something like a ghost which is driven with the key, like the toy with the key. Yeah, just like that, you will be running around cleaning stuffs and reading and doing all sorts of stuffs with high speed. They're running, they will be walking like running, just like the typical example is iodine, and they will be hot also because whatever they eat, it is immediately metabolized. They need so much of energy to meet the day-to-day demands of life, which means life is very much taxing. Life is very much snatching away the energy from their body, and that is the reason why sometimes it goes even into thyroid toxicosis. That is, the cell multiplication happens in the thyroid gland as such, causing a colloid goiter or a multinodular goiter, along with the typical symptoms, like the eye will be bulged out and all that. Why? The patient wants to see everything, wants to catch hold of everything, and he or she wants to perform, but are not able to meet the standards. So that will be in hyperthyroidism. Generally, where you are powerless or helpless, so much of demands is there and you are not able to meet the demands, and then you go into the other side, you go into the opposite side, you cannot perform, and then you sit simply, you sit ideally, or your brain is not functioning, you don't know what to do, you feel totally powerless, you feel totally energyless, drained out, sleepy, constipation, sluggishness, amenorrhea. All these things happens in the opposite case, where you are totally powerless and helpless and you cannot do anything. You just go into depression kind of thing. There, the hormone will be on the lower side. So generally when thyroid comes, whether it is hyperthyroidism or hypothyroidism, don't get intimidated by the name of the disease. You are not going to treat the hormones. You are not going to treat the disease in man. You are rather treating the man in the disease. If you can have this concept in your mind, the fear about the disease will be gone. Now, when you are like intimidated by reading the values. Okay, the TSH is so low, it is 0.02, and then the etc. etc. No, sometimes the TSH will be so high, like 400. So you are intimidated by the values. You are only treating the man in the disease. What has this man undergone to have this kind of a disease? Where did his life cycle go berserk? Where did he not able to perform? Where did he not able to live up to the expectations of his family members or the teachers or whoever it is around you, according to the society or according to the demands of the family members, or according to the demands of the husband or family members, or father-in-law, or social society, or etc. etc. So thyroid can come to any constitution, any person at any strata. Thyroid can come not only for children, for ladies, for pregnancy time, during the time of puberty, then even at the postmenopausal time, even at the very normal state also, they can have the thyroid. So according to the life situation, you have to analyze when did you get this thyroid, or when did you notice that you are having a thyroid, or what made you do the blood test to find out whether you are having a thyroid or not. So they will say that at this time we did the test some 1 year back or 2 years back. What happened at that time? And what was the first symptom that made you suspect about thyroid? Why did the doctor think that you are having a thyroid? Maybe you are having a thyroid. Why don't you do a blood test? What was that symptom which made you to go to the doctor? Which made you to approach the doctor, and the doctor thought that, okay, I have to write the thyroid test. So that will be the first symptom. Either it is a dryness, or it is an itching, or it is an excessive hair fall, or it is a weight loss or weight gain, or lack of appetite, or sleeplessness, or anything, or even lack in sexual libido also. There was a person here who had come to me, a man. The man did not come, rather his wife came up and she said that there is no interest in life at all. What is the meaning of life? Then she made a big she was crying and all that. She was a pulsatilla constitution. She needed consolation, especially from the husband all the time. And this husband was working for the firm, that means for the company, running day and night, 24 by 7. He was thinking about his company and about his boss. What is that? So he did not have a life of himself. Life for himself, he did not have. Constantly, even while lying down, anything and everything, he was constantly thinking about his boss and his company in his mind. Compromising, yes, compromising his life. So that was like, I thought that he could be Beraita because he was not leading a life. If he is able to lead his life and he is responsibly doing the job of his boss or company or whatever, that's what is needed, right? You should think about your boss and you should think about your company all the time, but not at the compromise of your life. When your identity itself is lost and you are working like a dog for somebody, then it is something like a low intellect kind of thing, or rather not able to balance between the two. And I had given him Beraita based upon this. And then he improved like anything. His TSH became normal immediately. And his wife came up congratulating me, thanking me that they are having a very normal husband and wife relationship now. So that is what is our aim, not the paper value becoming normal. Whether the thinking, whether this man is relaxed, whether this thing has gone out of his head, that is our question. Okay. So this is a small gist about thyroid. Any doubt about that?
Ma'am,
Yes.
madam, actually, my intention of asking this question was because in some reports, no, there will be estrogen is high, sometimes progesterone is low, sometimes estrogen is normal, progesterone is too high, but still there will be no stoppage of menses. Sometimes prolactin will fluctuate. How to understand this hormonal from the hormonal reports? How can we identify the pathology of the mind?
These are two opposite
Why?
hormones. One is estrogen and the other one is progesterone. Progesterone is the thing which holds on and estrogen is the thing which lets out. Okay. Progesterone is against abortion. Progesterone is to hold, is to keep the baby, or is to keep the periods. There will be no periods when the patient is having a high level of progesterone. There will be no bleeding. There will be amenorrhea. During the time of pregnancy, the progesterone hormone will be on the higher side, and there will be no periods for that 8, 9, 10 months. Yeah, there will be no periods because it wants to keep the baby, it wants to prevent the abortion. Nowadays, when ladies are having all this spotting immediately after the conception, the gynecologist will generally give kind of tablets, no, like Susten or something that will be high in progesterone. These injections are given in order to keep the baby, to prevent the abortion. So when the progesterone hormone is on the higher side, there will be no periods or very less periods only. In the form of spotting only the periods will be coming. The normal flow will not be there. Just the opposite happens in the estrogen level. If the estrogen is on the higher side, it is letting go, and the periods will never stop. There will be a copious flow, very heavy flow, and there will be protracted flow. The flow will never stop. So in PCOD, you can see all these variations. All these variations you can see. Progesterone will be on the higher side. That is why there will be no periods for months together. Or if at all the periods comes, it will be in the form of spotting only. So that is all because of high levels of progesterone. When the progesterone falls, there will be, when the estrogen goes high, with the high level of estrogen, there will be bleeding. There will be heavy bleeding.
And
So
when to advise them to do the hormonal testing. Actually, it is what a report I have shared. It is a case of PCOD, ma'am, and the patient was having this hydrosalpinx. So they have operated. After operating that, she developed endometriosis and adenomyosis. So she came with that stage, and they have inserted Mirena. So she came with this stage. I took the case. Initially, I was not getting specific conflict. So based on the disposition and the pathology, so I have entered with two rubrics. I gave her calcareous sulfur. It took almost 6 months, ma'am. Endometriosis, adenomyosis completely gone. And they have operated fallopian tube and left ovary they have taken out. So after the medicine, she started getting regular menses. Uterus was there only with one ovary. She is getting regular menses. Now, almost 1 year, she's completely normal. Now she was having weakness, dullness, lack of interest in life. I told them check your thyroid profile. So now it found that ATPO was too much. It is more than 1,000. So what is the journey of disease? How it got suppressed? How she landed into autoimmune suddenly? Periods was normal. Almost 1 year it was normal. So there was no any restriction.
what is
I
her
was
age
giving
now?
only yes. So her
Yeah,
age
very
is 43.
43. And
Yes,
even now
ma'am.
her periods is very regular, which means her
Yes, ma'am.
the
After
guidance is
calculating herself, she also they also did the pap smear, so it was negative. And then after calculating herself, PCOD got completely clear. They given there is no cyst in the report also, and she got a
very good.
skin tag at the vaginal regions. She got tagged. I was tempted to give some medicine for that tag. She was complaining so much of painful, so much. I gave repeated SL heavy half an hour for 7 to 8 days, and finally the tag also it came out completely. She was
Very
normal
good.
for almost 1 year. Now she went into autoimmune thyroid.
Yes, yes.
Wantedly, because of chocolate cyst, they have removed the fallopian tube and left ovary.
Hmm.
So from there, they have genetically they have disturbed her by inducing operation. So
Hmm.
this is how she went into this autoimmune. But now, how we should approach this case, ma'am?
Yeah, now she has come into the autoimmune level. So now, according to the symptoms, there will be lack of interest in life or some kind of a death desires. So you will have to pick up the autoimmune rubrics. So now she is only 43 years of age. So life is still lying. So there is no question of this is an early autoimmune, no? Like due to suppression only, she had gone into the autoimmune. But then I should say, I must congratulate you, Sai Narendra, that you have taken care of the gynec system very well. The PCOD or whatever, no, the hydrosalpinx or whatever, the adenomyosis, and with whatever picture the patient had come to you, you have given her relief for that, and her gynec system is now regular. Her periods is now regular. This is a very important gift that a doctor can give to a lady. So she can calculate many things according to her periods, and that is very important in her day-to-day life. So that is one great hats off to you. So much of thankful the lady will be towards you, Sai Narendra.
Thank you, ma'am.
And yeah, the next thing is somewhere she has gone into autoimmunity. So this would have been there from the beginning in the background. Certain persons will be like they will be reproaching self for all these things, or they will be blaming themselves for anything which had happened in their family. And this is the exact reason why she had developed adenomyosis and chocolate cyst. All these things are also pointing towards autoimmune, or rather, they will be having little bit of anger and resentment at that time. But then now with the age, as the age goes on, or when they are coming to the next stage of life, more realization will be there, and they will take that into the autoimmune rather than blaming others. So more adults or old age people will be having autoimmune diseases rather than the young people. Why? The young people will retaliate it off to, or they will start blaming others. They will blame our parents, everybody. They will not take the blame on themselves. When they take the blame on themselves, they will go into autoimmune. Maybe this lady has gone through many things. So you will have to, again from the JOD, what all things the lady has underwent from her childhood days. All these things will point out to the personality of the disease. And right now she is an autoimmune condition. She is in the autoimmune condition. So you will have to pick up the personality will be shown in the autoimmune rubrics, the highest rubrics. All these institution criticized or injustice, intolerance, unwanted criticisms, or all these things, no, like our sensitivity, all these things are now in the highest of highest stage, that is in the autoimmune stage. Yes.
Normally, that Yes, normally if the TSH is low, there will be TRAP positive. So 3 to 4 patients I have seen like that, ma'am. Normally if the TSH is ultra sensitive, then there will be TRAP antibodies will be high. But in this case, no, TRAP is normal, ma'am, completely normal. But ATPO is high, ATG is normal. It is
Yeah,
something
yeah,
like
yeah. Okay. See, generally, don't go into too much of specifications. Then you will be treating the paper rather. You will be missing out the patient somewhere. Okay. So go into the needs of the patient. Why is the patient autoimmune is our question. Okay. So don't look into the just like that. I don't know what to say more about that. Maybe my experience is only this much, Sai Narendra. So according to my experience and my knowledge, what my advice is to treat the man in the disease rather than going into the values. You know that the patient is in the autoimmune state now. So look for autoimmune behaviors and where all does she go autoimmune? What are all the sensitivities which make her autoimmune? Take the highest rubric available. That is the only thing what you have to do now. So it will not be her GCS. So it from the childhood days, she will be having the autoimmune phase in her, or that will be hidden there. It is now only it is pronounced. So at that time, she would have had more of sensitivities, sensitive to rudeness, sensitive to reprimands, sensitive to anything, which when somebody scolds, etc. And what was her reaction at that time? All these things are the soric rubric. Take the highest rubric of the same thing, that will be an autoimmune rubric. Like it will reach to the something related with the death rubrics, like the death desires or suicidal tendency or suicidal thoughts or death presentiment of or death conviction of anything related with the death or weary of life or existence, miserable, despair. All these are autoimmune rubrics. So you can go into the higher rubric, something related with the life and death or with the existence and death. Such kind of rubrics will help you to tackle the sixth layer disease. So anyway, the disease is gradually progressing from one layer to the other. So now it has reached the sixth layer. So accordingly, you have to tackle. That's it. Once the patient is out of the disease, so you can, what will happen? The patient himself will come and tell that no, now I am very much happy. Now I'm very much positive in my life. I am able to do my day-to-day activities with full energy and with full involvement. Right now only I am leading my life so nicely, so happily, etc. Which means the autoimmune, that faculty is disappeared from the left. That faculty is taken off. Then, if there is any weakness or if there is any further complaint, you can always think about the GCS. Otherwise, no need. Just go on and on, give them SL. That will be fine.
Yes, ma'am. Thank you, ma'am. Ma'am, one last question, ma'am. Madam, generally nowadays the people with PCOD, they're coming with all hormonal reports. So
Mm,
these hormonal tests, some people they do before, during, or after periods.
mm.
So when they come with the reports, no, there will be follicular phase and menstruation phase and mid-cycle phase and luteal phase. So yeah, sometimes in the follicular phase levels are high. But what we should consider, ma'am?
The
Only
ideal
I will.
time, the ideal time to do all the hormonal tests will be day 3 of the periods.
Day three, day
Day
three
3.
after periods.
Yes, that will be the ideal time. And to do the scan will be immediately after the menses, maybe on the 4th day or on the 5th day. So then you will know what is there inside the uterus. When it is in the secretory phase, all the unwanted, everything will be exaggerated. The size of the ovaries or everything, the size of the endometrium, the thickness of the endometrium, everything will be secretory, no? Then it will be more thick and all that. And the polyp will be bigger, everything. So immediately after the periods, that is what is remaining in the uterus. What is remaining in the uterus? That is what is to be treated by us. The secretory phase is a natural phase. So don't advise the patient to do the scan during the secretory phase. Immediately after the periods, the lady is ready to take the next cycle. Even before the next cycle starts, at the end of one cycle, catch them there. Do the test now and come on the 5th day or on the 4th day. And the best time for the hormonal analysis, by the time the hormones are ready for the next cycle, that will be on day 3. So AMH or FSH, LH, estrogen, progesterone, everything, whatever test you want to do, the hormonal test, the female hormone test, do it on day 3. Then there will be no confusion.
Yes, ma'am. Once there was estrogen was normal, ma'am, but progesterone was high. So where the patient was bleeding continuously, she was not stopping. She did these reports. From there, I entered with antagonism.
Very
Even
good.
though progesterone is high, so immediately it got stopped, ma'am. But I doesn't know how to differentiate.
This is how it is. So anywhere there is some hysterical behavior, some antagonism. That is the reason why this happened. No, with high levels of progesterone, the bleeding was there, and with estrogen, the bleeding is not there. So all these things are antagonism. So that's how you manage, Sai Narendra. Take the case properly. Pick up whatever rubrics are coming to your mind, which will be appropriate to the case in front of you. That's all. Rule in, rule out with disposition. Don't make it too complicated. Day 3 of periods. Yeah, not after periods. Day 3 of the periods, Kyle. Day 1, day 2,
Yes,
and
ma'am.
day 3 of the periods. Day 3, you have to do the hormonal test if you want any in it. Scan will be on
Thank
the
you, ma'am.
last day of the menses. Once the lady is clean, no, like maybe on the 4th day or the 5th day, the period stops completely, and the lady is comfortable for the scan. Then you have to send them for scan. In case of amenorrhea cases, when to do the test? No, nothing can be done, Archana, at that time. Just if you want to do the hormonal assay, just let them do it. That's all. So then you will get some idea. You will not be getting the full idea, etc., what phase it is and all that. Anyway, there is amenorrhea. So if you want to do the test, just give it on any day. Not possible. No, the days cannot be counted there. Okay, guys?
Yes, ma'am. Thank you so much, ma'am.
Thank you. Are we ready to go with our reading?
Yes, ma'am.
So welcome all members once again. Thank you so much for giving me this space for reading the book of Dr.Prafful vijaykarsir, our guru, our mentor. So today we are reading about the third book, that is the end of Myassumptions of Miasm. And we have talked about the soric miasm, the psychotic miasm, and the syphilitic miasms. And now we are into individualization. Why every individual is different? Why every individual is having a different physical structure and mental behavior. So we have been dealing about the mental behaviors. Why is it so? Why everybody is different? That is because of the genetic code. That is because of the genome. Every cell has got a nucleus, and the nucleus contains the chromosomes and the genes. Page number is 106. Chapter 13, page number 106. Hope everybody has got this book. Welcome all new members as well. Yes. So are we all ready to go? So we have dealt with the physical intolerances, physical structure, mental makeup, tolerances, intolerances, or susceptibility. Okay. So certain genes will be timid, certain will be confident, etc. We have dealt with few rubrics in the last class. I shall read that paragraph, okay? 106, that is the first paragraph. This is true for all human beings as well. All animals will be different and all human beings will be different. Why? Because for every animal also, the genome is different. As we know, the genes make a man or any living being. These genes are responsible for their physical structure, mental makeup, and other tolerances, intolerances, or susceptibility. Here we dealt with the lean constitutions, the obese constitutions, and other few mental makeup like mildness, etc., etc. No? If genes have timidity and lack of will as one of the qualities, then compensatorily, there are other qualities the genes have to or must develop to create a balance so that individual survives. For example, if an individual possesses the gene of timidity, weak will, then it is obvious that this timidity can never make him fight a battle for survival. Then what will he do? This quality cannot give him toughness needed to frighten or fight the opponent. Therefore, it has to be endowed with the innate characteristic to escape. If he cannot fight, he cannot simply stand there and give and take the beating or take the assault. He will have to run away for his life, or he have to escape. Or the quality to resign or to be mild with no confidence in oneself, or to be bashful or to hide, etc. All these negative innate characteristics basically develop as a reaction of the negative will. Now, come on, give me the medicines. What are all the medicines? Our materia medica is so rich that we have so much of medicines which can be used, which will give you a spark in your daily practice. when we discuss about such rubrics. What are the timid remedies? Which are the remedies those remedies will want to escape from the situation? Which are the medicines which will want to escape from the situation? Yes. Many answers. Baraita, Calcari, Lyco, Pulsatla, Ambra. Very good, very good. You are all ready with the pen and paper. That's right. Okay. So here, the drug remedies are there. All the drug remedies are there. No, like the belladonna, hyoscyamus. This will be one easy method to remember the medicines. Yeah, some easy method is like belladonna, hyoscyamus, and stramonium. These are the drug medicines. Yes. Where will you think about hyoscyamus running around? One thing is hyoscyamus has got that dromomania, that is mania to run about, especially after having alcohol and all that. It will be run amok kind of thing. That is the syphilitic rubric then. But then this escape attempts is not a syphilitic rubric. It is to hide. It is rather psychosis. It cannot defend itself. So in typhoid fevers, you can think about escape attempts in belladonna, hyoscyamus, stramonium. Then the trio of all these things, that is veratrum, and other drug remedies like opium. All these things have the escape tendency too. And in Arsalb and Naxomica, again with fevers, they will be having all sorts of restlessness. And Arsalb generally has a fear and like a typical kind of fear where he will be arrested, delusion arrested he will be by the policeman. Then Arsalb will try to hide. So all these things are certain kinds of deliriums or delusions which are coming during the time of a fever. Kyle is saying recently I treated a case of typhoid with opium. Very good. Kyle, can you narrate that then? If you are ready, can you narrate it shortly? What made you think of opium? It will be an eye opener for others as well.
Yes, ma'am. Actually, she's a school student, ma'am. She's in 12th now. She has gone to the school and she was before the school opening, she has gone to a theme park and she had some outside food also.
Yeah.
Mild stomach pain and little diarrhea was there, but that was not very much disturbing. But as soon as she went to school, she started developing fever in the evenings alone. 101 like that, 102 fevers. So I was just inquiring her all other symptoms. Nothing was there, just only headache and fever. No other symptoms were there. But generally, her like she was very quiet and she was not at all complaining. She was not telling of any other. She was just lying down, and I couldn't get any symptom out of her actually. Only
Very
the
good.
headache, but severe headache was there.
Yes.
So after that, I just checked for the acute chart, and I was for the so much contented she was. So I thought of opium, and no other
Excellent.
symptom, only headache and everything.
Excellent.
So I
Very
gave
good.
her opium. First 200 I gave her, ma'am, and she was
Okay.
improving. She improved immediately after opium 200. So I was very happy. Okay, she'll be better. But later, after 3 4 days, she again started developing fever and same headache, same symptoms. So I thought maybe the potency was not enough. So I prescribed her opium 1 m, and she was immediately cleared, ma'am. Actually, she didn't have any stomach pain and all earlier. But she started getting like mild stomach pain after giving opium 1 m. But her fever, headache, all that subsided. She was able to eat normally, all that. So I just advised her some diet alone to maintain for 1 more week.
Yes,
Her stomach pain also subsided after some time, ma'am, after
yes.
maintaining the diet.
Very good. Very good. Because we are not treating
Even
the
I didn't
stomach
expect
pain.
her to get better with opium. It was good.
Single remedy will do. Dr. Chandrasekharan had come to me yesterday evening and he was asking about the acute chart and how to deal with acute cases. Not only acute cases, but of course, all the other cases. We all want to tackle all the cases, not only acutes. But then I was advising about the acute chart. And this is the beauty, Dr. Chandrasekharan, if you're hearing this. So there, no, like how beautifully Dr. Kayalvedi has come to the point. Like the patient is hot and thirsty or thirstless, and that is not the that is not the crux here. The patient was uncomplaining. This uncomplaining with lot of headache
Yeah.
and with the attitude itself will be rather kind of dull or contented. there will be no reactions. Like, if it is a Naxomica, how Naxomica will react when the doctor is asking one or two questions, the patient will show, I have told you already, or the patient will have that face of a frown on the face, and sufferings, too much of sufferings, no, like intolerant to light, intolerant to noise, and all these things, no, like impatience waiting outside. Avota, yes. What is avota? Anger when obliged to
Anger
answer.
and obliged to answer.
When the doctor is asking for confirmation, one or two questions, the patient will be having that irritation on the face. Like that, the patient will be showing the irritation. Whereas in opium, however time you ask, the patient will be like sitting gently, calmly, and maybe with a smile or without a smile. Sometimes it will be rather dull, or it is not dull in intellect, but then physically it will be dull at that time, and it will be uncomplaining. There will be a lot of viral throat infections and all that. Everything is congested. The patient is unable to swallow. I had a case of hand, foot, and mouth disease. Chandrasekharan, I am telling this for you, dear. So all these things will be like small cases, which will be an eye opener for you in your day-to-day practice. Hand, foot, and mouth disease. Everybody would have treated that. But then how will you treat a hand, foot, and mouth disease? Is there any prescribed medicine for us? No. It can be any medicine. It can be belladonna, pulsatilla, naxomica, any medicine it can be, according to the disposition of the patient and the thermals and thirst. Here the patient was, I did not ask directly into the thermals and thirst here. Dear, what did I do? By seeing the patient itself, there was little bit of saliva coming out. What does that mean? Is it Merxol immediately? Okay, there is a tialism, there is too much of salivation. No, why is it so? The patient is unable to swallow. Why is it so? Again, when I looked in with my torch, I could see that the entire throat was studded with anathema. A lot of eruptions were there, and viral throat was there. It was scarlet red. And scarlet red means immediately belladonna comes to our mind. Is this a case of belladonna? Belladonna, how he will react? He will be talking too much. He will be hyper. He will be having that red congested face and a happy face rather, or it will be delirious and it will be having that high energy, or it will be like laughing or talking loudly, saying good morning to the doctor, etc., in a loud, elated manner. I had cases like that also, where what potency will you give if it is belladonna? You will give 1 m potency or 10 m potency, because the intensity is very high. According to the susceptibility of the case before you, the medicine is decided and the potency has to be decided. If it is belladonna, with all these reactions of the patient, you have decided upon belladonna, give the highest 1 m or 10 m. Then how much time will it take for the relief to come? Immediately, within seconds, because it is similia similibus again. If it the according to the susceptibility, according to the intensity of the symptoms, you have given the potency, and immediately the result also comes in. After 5 minutes, the patient will be able to drink water. Here in our case, coming back to hand, foot, and mouth disease of the opium case, the patient was sitting quietly, 6-year-old boy. He should have cried, no, because of the pain, and he could not eat anything for the past 1 or 2 days. And his grandfather was crying, but this child was not crying. He was rather sitting, that's all. No expression on face. No expression on face is one important rubric, one important symptom of opium. No expression on face. Then it will be rather dull. It is not dull like Baraita. It is because of the pain, the benumbing pain. The patient himself is benumbed. The patient does not produce any reaction. The patient is just like that sitting. The patient has got pain. Is it the painlessness of painful condition? There is pain here, Archana, but then that is the reason why the patient is not moving the throat. The patient is letting the saliva down. He cannot swallow. He has got pain. Yes, it is the drug remedy opium. Once that thing, that is the crux of the disease, is contentedness, or rather uncomplaining. Then you know, okay, is this opium? Then you ask, what is the thermals of the patient? Does he want a fan? Yeah, he wants the fan, will be the answer. Does he want a bed cover in the night when he was having 1 or 2 fever? No, he was rather hot. He did not want, even he wanted to unbutton his dress, and he wanted the fan in full speed. And whenever his mother was trying to put a bed sheet on him, he was taking away the bed sheet and he was lying like that. What does that mean? The patient is a hot patient. This is how you understand the thermals of the patient, because the patient doesn't know what to answer when you ask about whether you like hot or chilliness, which climate. Sometimes the patient doesn't know how to answer. But then ask for certain things, in what water will you take bath, etc. Then the patient will be saying, I always take bath in warm water. Even in summer, yes, even in summer also I will take in warm water. Then you can understand that the tolerance levels for the hot is good, which means he is a chilly patient. If he is a hot patient, he cannot take bath in hot water in the summer seasons. This is how you rule out. Okay. So all these things are for the newcomers. So now let us, which is the most complaining remedy? With the Kali group, Kalvima, quarreling with the bread and butter. Kali is the most quarrelsome remedy.
But ma'am, Kali like to be with family or not?
Kali cannot have an independent existence. Kali is potassium. Kali is very, very agitated thing. Sodium can remain. Sodium is rather contented. Kali cannot remain contented and all. It will go, it will flare up. How the ECG will be for a hyperkalemia patient? ECG will be jumping up and down like tent. T wave will be like tent only. It will be. So it will go into flutter if it is not given importance. So Kali cannot be controlled. Kali ars, Kali brom, Kali silicatum, Kali carb, all these Kalis, Kali force, all these things, no, like when excruciating pains are coming up, you can think about Kali force. And if the pains are more severe in the nights, then you can think about Kali iode. And the pains are coming in spots. All these things are syphilitic pains. If it is in spots, then it is Kali bichromicum. And the patient is constantly blaming, no, like he's mentally affected. And then you can think about Kali bromatum. And if the patient is having a lot of hypochondriasis and anxiety about health, for the smallest disease, if the patient is thinking about cancer and such kind of destructive diseases, he is so much hypochondriac, you can think about Kali Rs. And Kali carb, yes, Archana. And Kali carb will be like he will be eating the doctor with lot of gas, back pain, weakness, and gas. This is the trio of Kali carb. And all these Kalis, no, like the doctor will be irritated by this Kali. The Kali will be eating the doctor, eating the ears of doctor and the brain of doctor. He will not allow the doctor to think or to put a question. Before putting the question, Kali will jump. If it is so jumpy and so irritating and so much questions he will put on, unwanted questions, kind of irritating. The reaction of the doctor is irritation. Then you can think that this patient is a Kali. And now you have to rule in and rule out what kind of a Kali is he. Is he a syphilitic Kali or a psoric Kali? Pain at night is Kali iode. Pain at night means the diurnal variation is night aggravation, that is syphilitic. Kali iode is the most syphilitic remedy. And Kali bichromicum follows, that is pain in spots or pain erratic, jumping from one place to another. All these things are syphilitic, jumping from one point to another, erratic pains, and pain pinpointedly at one point, that is pain at spots. All these things are syphilitic. So Kali iode, Kali bike. Entry point for Kali nitricum. Yeah, Kali nitricum again, another explosive. All nitricums are explosive. Kali nitricum will be even more explosive. Kali nitricum, generally any affection of the mucous membranes, recurrent aphtha or leukoplakia, or any non-healing ulcer inside the mouth, you can think about Kali nitricum. Yes. So this is the most irritating group in our materia medica. Kali carb will be rather psoric. You can see lots of Kali carb in your daily clinical practice, because which patient don't have a gas? Is there anybody who does not have a flatulent complaint? Is there anybody? That is quite common, no? And quite common is a back pain. And if the patient is combining these two things, when the patient is complaining about a weak back, how will the patient complain about weak back? The patient will come and rather sit, no, like it will fall on the chair, and it immediately wants the back rest. And it will like that, it will exhibit that weakness. And the patient will be holding here and standing. And the patient will be complaining by holding this place. Means it is the low back pain with so much of weakness also. Then you can immediately put forth the question of whether you are having gas complaint or not. The patient will immediately say, yes, always I am bloated. And again, a big complaint will come around that. When the Kali patient opens his mouth itself, you will be able to understand that, yes, this is a Kali. And the most common Kali is Kali carb. In the day-to-day practice, it is Kali carb. And if it is so much of fastidious and very neat and clean and all that, you can ask about such questions, no? Then they will say that, yes, after cooking, no, immediately the gas stove, everything, the platform, cooking platform, everything should be completely clean. And I cannot see anything in the clinic or in the room, anything with the smallest speck of dirt. I will want to clean that, and I want to keep everything in stack and order. I'm a very systematic person. But what is this disease, doctor? Is this cancer? Should I want to do a scan, or do I want to do a PET scan, doctor? Sometimes you may overlook all these things, but I think I'm having a cardiac arrest. Should I go for the echocardiogram, doctor? Then what is the remedy?
Analysis.
Callias.
Alias.
Callias. Yes, Callias. 100 marks. Dr. Chandrasekharan, are you here with me? You understood what Calliars is? You understood what Cali carb is? Yes? Are you there? Yes. Very good. Very good. Kyle Vidi is saying some input. I have a lady always complaining or having some or other problem. I should think of Cali variants. Exactly. Exactly, Kyle Vidi. So this is how our Metria Medica gives the picture, the best textbook in order to understand the various constitutions are Kent book, Metria Medica, Kent's Metria Medica. There, the entire, it will be pages and pages of medicines, the polycrust, everything will be given in so much detail that it will be imprinted on your mind that when the patient books for the appointment itself, you will know. I have cured a case of Calliars who came for panic disorder after the sudden death of her dad due to heart attack. Very good, Archana. Very good. See how Calliars is matching to what we have said now. Calliars will be more that aggressive anxiety. She started thinking always about death and heart diseases. When somebody in the family is died, or when somebody of a certain age is died, okay, after 90 years the patient is having a heart attack and he died, but this patient is only 40 years of age, and patient will be thinking, I am having all those symptoms what my grandfather has undergone. Now I am going through a myocardial infarction, let me go and get the ECG done. And then you ask, okay, have you had this problem before? Yes, doctor. How many times did you do the ECG? The patient will laugh. I have done the ECG at least for 10 times. And every time the ECG was normal. Now, what is the remedy? The patient is giving away the clue. Dr. Chandrasekharan, this is how the patient will throw away the clue. Now, you don't have to do the case taking also. What is the remedy here? 10 times I have taken. Calliars. Yeah. So, Calliars, Calicarb, and then the syphilitic are. Yes. Syphilitic are caliiode, calibike, calicilicatum. Calicilicatum will be more for girls and all that, no? Like silica is more for student, what to say, good students. They are very regular to the school, very diligent school girls. Yeah, and if they are having the jitteriness of Cali, you can think about calicilicatum. How will you confirm calicilicatum? You will have to feel the palm of the patient. The palms will be chill and wet. It will be wet with the sweat. Cold sweat will be there in their palms. For all the silicata, you can think about that. You have to feel the palm of the patient. Then you can confirm that this is a silica group. So if it is very jittery, you can think about calicilicata. And calibrom, generally for old age people or for ladies who are having ovarian tumors, with huge ovarian tumors, chocolate cyst or dermoid cyst or any ovarian cyst which is rather big in size, macro, which means more than 5 centimeters, 5.5, 6 centimeters, 7, 8, big, huge ovarian tumors who are having lot of self not criticisms, but then self-pitying. Self-pitying is calibrom. And they will blame themselves, oh, why am I having all these things? I should have suffered, guilty. Yeah, I would have done something. Why is God taken me out for putting all his vengeance on me? Why is God so cruel upon me? Why all these cancers is happening to me? Why all these negative things are happening in my family only? Why always my child is only failing? Why always the teacher is catching my child only? Why always teacher is calling me only? All these things will be like self-pitying kind of thoughts will be coming for Kali Brome. Okay. Okay. So these are the things with Kali. So we were talking about escape attempting to. Okay. Why is the patient escaping? The patient is so timid, the patient cannot fight back. Then what do you think about Merc? Merc is also there. Merc soul. Merc is a very, very courageous remedy, defiant remedy. It is a very strong remedy. It always has the guts to fight back. But Merc is very, very good, Yashasvi. That is rebellious. Merc is rebellious. So Merc will always give back. But then why is Merc here in escape rubric? In escape attempt to, there is also Merc is there. Why? Merc sometimes has got that on the slide. Why? Merc is a metal, but it is a liquid metal. It will not stay in one place. It will be rather wavering. So Merc is not that very strong in that way. Merc has got lot of sadness in the background and lot of self-doubts and fears. Merc has got its own fears. Merc is a timid remedy. Merc is rather a timid remedy. But then when it comes to the upfront, Merc can change its color into the next level also. But Merc can be timid also. Remember, Merc, Aurum, Cuprum. These can be timid also. In the childhood days, Aurum will be very timid. In the childhood days, Cuprum will be very timid. Merc will be very timid and sad. The sadness of Merc is very prominent. Sadness for very small things, like sadness with a cold. I'm having a running nose. I'm having a headache, a sinus headache. I'm having an ear pain, and the patient will cry. Not crying out of pain, but crying out of sadness. Sadness with any small complaint. You can think about Merc. So Merc is escaping, attempting to escape. Why? Because of fear of having committed a crime. Why is this Merc trying to escape? Merc has got that fear. Why is Arsalb trying to escape? Because police is coming to catch me, so I have to escape. Why is Merc trying to escape? Because I have killed a person. I have committed a crime. And that is why I have to escape. So these are the differences. And there is a remedy, colosynth. Colosynth is escape attempts to during the time of abortion, maybe because of the pain, excessive pain and spasm, and the patient is undergoing an abortion, and the patient is in delirium. And here the patient will run away from the hospital bed. Running away from the hospital bed. You would have heard, no? I have put my grandfather into some hospital, and he is not able to swallow, and he is on ventilator, he is on IV drips, and he has put a Ryle tube also, and the patient is pulling away all the Ryle tube and everything, IV drip, and patient is jumping and running away from the bed. Which are the remedies? It can be the drug remedies like belladonna, hyoscyamus, stramonium, or veratrum, or it can be other low-lying remedies like bryonia. Ourselves, bryonia will say, no, this is not my home. I want to go to my home. And bryonia will be showing the anger and leaving the place. Ourselves, again, because of the delirium that police is coming to catch me. Crotalus horridus, again, it is a because of the sepsis and all, the patient can undergo delirium. Cuprum, Naxomica, Rustox, all these are remedies which can throw away all this, snatch away all those, or not snatching, but then putting away all those tubes and all, Ryle's tube and all from the hospital bed, and they are running away. All these things are because of the deliriums and mania, and maybe in the coma state also, they will be behaving all these things unknowingly. So dears, it is now 5 minutes more for us. Dr. Sophia is giving some inputs. Fear plus violence, very nice. Stramonium. Fear plus violence is stramonium. What does that mean? Fear plus violence means the patient is violent. and the patient will be running around, and other people will have to catch hold of this person when he is coming to the clinic. If they leave off the hand, the patient can attack us, which means the patient is violent. But then why is he violent? Because of fear. Because of fear. If he is not attacking us, what if we all jump and attack upon him? This is the reason why a stramonium is violent. Stramonium is not violent because of violence. Stramonium is not a violent remedy at all. Stramonium is a great fear remedy. Because of the fear, he becomes violent. Because of the fear, he goes into panic, he goes into delirium, he goes into mania, and he does not know what he is doing. He only knows that he should protect himself. There is nobody in this world who will be protecting him. That is why he wants to protect himself, and he is clawing because of fear. Clawing means what? He will be clawing the face of the father. He will be clinging to the father. He will be clinging to the neck of the mother. He will be clinging to something and all. Don't leave me away because somebody is coming to attack me. And in the dire situation, the patient will push away us also. No? Violence with fear, that is stramonium. Sensitive to physical impression, sensitive to mental impression. In which condition? In acute conditions. In acute conditions. Or to complete a chronic case. Because that is only the sensitivity of the patient. The sensitivity will be more important for us in the fever cases or in the pain cases. In the pain cases means even when you switch on the fan, you will be having the pain. Or sometimes the patient will cover neatly with a cloth or something, or hot water, touch of hot water, the tooth pain and all, no, like with a touch of ice cold water or just with a touch, the pain will be there. Or in fever cases, sensitivity, mental sensitivity, physical sensitivity, all these things are pointing towards the acute cases. Okay. Dr. Sophia is saying, one of my patients went into this state after surgery and was admitted in ICU. He wanted to get out of the ICU, became very violent and was tied up. Stramonium helped him calm down and come out of ICU. Yes. Yes, Dr. Sophia. Very good. Stramonium, what potency you would have given? Can you share that? 10M, very good. If it is 50M, that would have been even ideal. I have a case of an ADHD child. Like it is autism. It is autism. And this child used to come to our study class previously to Dr. Kugapriyan's place. Now the child is doing very well. She is talking now with monosyllables, and she is indicating to what all things she wants and all that. She was having a lot of syphilitic symptoms. One of the syphilitic symptom was, yes, junior doctors, please remember this. The syphilitic symptom was that she was not sleeping at nights. She was shrieking at the pitch of her voice. In shrill voice, she will be shrieking the entire night in the night. Entire night. Just a minute, Yashasvi, I shall answer to that. And then stramonium 50M has been given. And when you try to pacify the child, because at that silent hours of night, how much difficulty it will be for the neighbors to sleep around. This child's noise will be like shrill voice, the child will be crying out. And if somebody tries to pacify her, she will just claw upon us. What is the remedy? Stramonium. And which potency? 50M. After that, there is no syphilitic rubric, and the child is coming back to the normal studies, and she is showing interest in studies and other therapeutic classes. Now, Yashasvi had asked me something. Let me see that chat. Till what age is copying others' habit is normal, and can identity rubrics be taken for teenagers since identity is not fully developed? Yes, for teenagers, you can take that identity confusion. What is this? Dr. Yashasvi is asking. I shall make it clear, because in certain cases, children will want to copy others. For how many years will a child copy it naturally? How are we all learning or evolving as a personality? We are all copying somebody, no? There will be a role model for us. Vijaykarsir is a greatest role model for us. Yes. And many other eminent doctors are role model for us. Dr. Samuel Hahnemann is role model for us. How? Because he will get up early in the morning, he will sit at 4 a.m., he will sit and read and all that. Okay, from tomorrow onwards, I shall also get up at 4 a.m. and read. So this is kind of copying, this is kind of taking inspiration. Every one of us do copy. But then when that is hiding our personality, then it is identity conflict. You cannot be Samuel Hahnemann, you cannot be Dr. Vijaykarsir, you can only be yourself. But then you're trying to copy others. How? The good things you are taking from others and you are incorporating that in your timetable. Identity, yes. When you're behaving like a Doraemon, like a Shinshan, when the child is asked for, well, the child will be talking like Shinshan. Yeah, not got it, dear? The error in the personal identity should not be there. We all copy throughout our life, but then not at the compromise of our own identity. Since the identity is not fully developed, yeah. Since the identity is not fully developed, also there is an identity, no? Yeah. This child is named so and so. And if the child is having that confusion that right now I am the teacher, yeah, if that confusion is there, then that has to be treated, that is abnormal. If the child is playing a teacher game, nothing wrong. He will be mono acting, no? Like he will be acting like different persons, making different actions and voice. That is all quite normal as far the drama is concerned or as far the play is concerned. After the play, the child is back to normal. There is nothing wrong in there, in whatever age it is. So now it is already 11 o'clock. Is there any quick questions or shall we wind it up for today? And then let us try to continue our classes in the next coming Thursdays. Yeah. In between, I hope all of you people are included in that group, right? Dr. Atira and Arya, please take care of that, no? If who are all not there in that group, no, like Dr. Sir's group, please add them so that any discussion, any doubt, any immediate discussion or doubt, you can put the question there. Any senior doctor will try to answer you. Thank you, Shubhangi. Thank you, Yashasvi. Thank you so much, all dears. Bye then, take care. So any question, please post in the group. And all of those who are not in that group, please contact Dr. Arya or Atra or contact me. Yeah. Thank you guys. Bye then, take care. Love you all.
Thank you so much, ma'am.